You already know CBD, but how does CBG match up? Maybe you're wondering how to keep all of these cannabis products straight. Well, there's no cause for concern because we're detailing all of the CBD and CBG differences, benefits, and uses you could ever want. This way you'll be a regular cannabis connoisseur in your own right. After all, information is power, and this information really is something to consider. It's especially interesting for those looking to potentially better understand their own health conditions and the options that are present. What is CBG? Cannabigerol, also known as CBG, is one cannabinoid found in hemp and cannabis plants. It is found to be a minor cannabinoid because it is less produced in the cannabis plant compared to cannabidiol, CBD. However, CBG is a product of cannabigerolic acid, CBGA, just without the acid properties. What is CBD? CBD is found in high concentrations in hemp and cannabis plants as well. It is the better-known cannabinoid by far, with more research than CBN. Some may say that CBD is non-psychoactive, but the more accurate term is non-intoxicating. CBD influences the body's endocannabinoid system, ECS, which impacts the body and the mind. So while both do work, the term non-intoxicating incorporates the body into the conversation. Differences between CBG and CBD. While they both have similar properties, there are also differences to consider. This includes their actual chemical composition, which differs and also impacts how they activate receptors like serotonin. Two studies have also looked at how they both stimulate appetite. One study using CBG revealed that test animals actually ate 2 times their normal food intake. However, another study using CBD found that it significantly reduced total food intake. Does CBG get you higher than CBD? No, CBG does not get you higher than CBD. Both are non-intoxicating cannabinoids because in most cases they do not contain THC. THC is responsible for the high-like feeling that many users experience. CBG versus CBD. Common uses. According to the Salt Lake Tribune, CBG has shown effectiveness in reducing inflammation, in potentially treating depression and anxiety, and in treating sleep disorders, such as insomnia. In contrast, studies have shown that CBD may work as a serotonin agonist, an activator, to reduce nausea, sickness, and vomiting in animal subjects. This same study also found that CBG works in opposition as a serotonin receptor antagonist, a blocker, which then was shown to reverses the effects CBD has on nausea and vomiting. This is just one study, but it suggests that although similar, CBD and CBG can act differently in the body. Health benefits of CBG versus CBD. Discover magazine breaks down the health benefits of CBG versus CBD to aid patients in understanding how they might be similar, but treatment can differ. For example, without a ton of research, CBG may offer potential therapeutic benefits including appetite stimulation, anti-cancer properties, antibiotic properties. However, CBD has been studied for longer, and according to Discover magazine, the therapeutic benefits may potentially include pain relief, improved sleep, lowered stress and anxiety, neuroprotective properties. However, an increase in human trials will further solidify the understanding of how CBG and CBD interact in the body. Benefits of CBG. CBG is sometimes referred to as the Rolls-Royce of cannabinoids as it is only one of more than 100 cannabinoids found in the hemp plant. Our CBG oil is a crafted and rare blend that contains terpenes such as limonene, caryophyllene, and pinene. There are 2 options to choose from depending on your preference of concentration. We offer a 1000 CBD plus 1000 CBG tincture and a 2000 CBD plus 2000 CBG tincture. For use, we recommend filling the dropper halfway and then placing the CBD oil under the tongue for about 30 seconds. This allows for faster absorption, but it may take 1 to 2 hours to feel the full effects. But if you're new to CBG, we also recommend starting off with a very small amount before taking more. You can always work up to your desired effect over time, and not in one use. CBG for cancer treatment. As holistic options improve, CBG may potentially be an option for patients to consider. A 2014 study found that using CBG in rats with colon cancer may reduce the growth of cancer and tumor cells. Similarly, a 2021 study found CBG to be a potential therapeutic agent for glioblastoma. Glioblastoma is considered to be the most aggressive cancer among primary brain tumors. This means that with such an aggressive cancer type, doctors have not been able to find a successful treatment for patients. However, this study suggests that CBG may be used to potentially inhibit glioblastoma invasion similar to CBD and chemotherapy options. CBG use in treatment also extends to use for those with stomach and bone cancer. Researchers found that CBG may be effective against these cancer cell lines over CBGA. CBG as an antibiotic. A 2020 study found CBG to potentially have strong antibacterial activities against methicillin-resistant Staphylococcus aureus, MRSA. Similarly, a 2021 study found that CBG was shown to prevented a drop in pH caused by Streptococcus mutans, which is commonly found in tooth decay. With such pervasive strains affecting patients worldwide, CBG may present an option for doctors to further research. Before using CBG, it's important to discuss your medical history with your doctor. They can better direct you if CBG is an option for use. Appetite stimulation. A 2016 study found CBG to potentially be a novel, well-tolerated appetite stimulant in pre-satiated rats. There were no adverse effects reported, and food intake doubled along with the number of meals consumed. More research is needed to better understand the role of appetite stimulation and the use of CBG, but this does suggest a positive outlook for future researchers. CBD. CBD is the common cannabinoid that has created wide interest throughout the industry. If CBG is not the cannabinoid product for you, then you should consider other CBD formulations such as oil tinctures, Dream, Calm, Clarity, our original blend, and even a pet CBD oil tincture, gummies, original CBD gummies and nighttime CBD plus CBN gummies, bombs or aloe vera, CBD balm, fire and ice, CBD balm, original, and CBD aloe vera after sun gel, soft gels, CBD soft gels. CBD for stress and anxiety. With stress and anxiety always being a topic of concern for patients, the National Institute of Mental Health, NIMH, better illuminates this struggle. They estimate that 19.1% of adults in the US have experienced an anxiety disorder. CBD has been shown as a potential treatment for anxiety-related disorders thanks to a 2015 research study. Pre-clinical evidence strongly supports CBD as a treatment for generalized anxiety disorder, post-traumatic stress disorder, panic disorder, and others. A more recent 2020 study evaluated CBD's effects on adults in New Zealand. Researchers found that participants that received CBD treatment for anxiety or depression reported improvements in their ability to perform daily functions and a reduction in pain and anxiety, depression symptoms. CBD for sleep. A 2014 study found that CBD may help improve REM sleep in those with Parkinson's disease. This is very important to Parkinson's research as REM sleep behavior disorder, RBD, is often associated with nightmares and active behavior during dreaming. Similarly, a 2016 case report found that CBD may be helpful in easing anxiety and insomnia for those with PTSD. While this report was more individualized, it does suggest that there are more options for those suffering from PTSD. Finally, in 2019 researchers found that administering CBD to 72 subjects yielded some interesting results. In the first month, 66.7% of participants reported better sleep and 79.2% reported lower anxiety levels. CBD for pain. In 2020 researchers created a review of CBD uses and the benefits associated with its use. They found that CBD is generally well tolerated, effective for intractable pain, non-psychoactive, and improved sleep. As chronic pain grows in commonality due to our understanding of opioid misuse as a public health crisis, it must make patients wonder what really works. One study found that CBD may even relieve pain through receptors of the endocannabinoid system. This 2018 study found that at the end of 2 weeks of CBD treatment, patients reported a 30% reduction in pain intensity, on a scale of 0 to 10, which is considered to be clinically important. For more information, visit our website hellobatch.com. Link is in the description box below.